One of the primary things that we need to achieve within, any treatment, I call it orthopedic stability or stability within the skeleton, and the skeleton meaning our upper and lower jaw, our jaw joints or our TMJs, how our lower jaw fits within the upper jaw. So, we can think of it as the upper jaw is a shoe and the lower jaw is the foot. If the shoe's big enough, the foot fits into it. Another analogy I use is that the lower jaw has a round head to it, kind of like a baseball, and it needs to fit in the upper jaw like a baseball mitt, centered within the jaw joint. When we have that there's health. We can open and close to a normal manner. There's no clicking and popping of the jaw joint. There is skeletal symmetry and alignment. So for adults, it's important to help with their TMJ health, clenching and grinding, stability with how their teeth fit together, muscle pain, head, neck, shoulder, jaw pain. And then it's also important that we need to assess this on growing kids. On a growing kid, if the jaw joint is not lined up, if there's not orthopedic stability, we can see the face growing sideways or with a cant, or the smile is uneven. Our lower jaw grows from the jaw joints down. And if the jaw is balanced or stable on both sides, we're going to get good symmetrical forward growth of the jaw on the face. So one of my primary, things is when we're assessing with our 3D jaw scan on kids and adults is how skeletally does the upper and lower jaw fit together? Because it affects how the teeth fit together. If the jaw is out of position, the teeth are not lined up in the correct position. And vice versa. Like if the teeth become out of position or short and worn, the jaw becomes out of position. So, it's like the old kid song, like the head bone's connected to the neck bone, and on down. And like it's true, like the upper jaw, the jaw joint, it's the most upper joint and it's the most superior part skeletally in the body, and it drives health within our skeleton all the way down within the body. So, an analogy would be like if one leg is shorter than the other or uneven, that we may start to hobble around or develop knee pain or things will break down. But if we put an orthotic in the shoe and now that the skeleton is balanced, you'll see that those symptoms go away. And same thing with the jaw. If the jaw's not lined up, that you're going to see things break down. And so it is the primary focus that we try to work on, and most of the time it's the very first phase of treatment that we do to help with growing kids. Our expanders are designed to help grow the jawbone, seat the jaw joints or the condyles in the correct position, drive that forward growth. Our first step for adults is balancing the jaw, getting that skeletal stability. Then we know where and how the teeth should fit together. So when the jaw is healthy and in the right place, it provides a blueprint for all of the next phases of treatment.